years. And they are of the same age. You can understand the people who are not very well educated and they want to earn fast. So they take up a job as a salesman. So what would happen? The other boys who were there in this organization would touch his right side of the chest, press and run away, as if they are doing a mischief. Like what they would do with a girl, that kind of gestures was done with this boy. So this boy started feeling very bad because more and more number of people started realizing, and it looks very odd. So what happened? This boy started wearing 2 shirts, 3 shirts, one on the top of other, to avoid any problem. Second thing, he was very, very religious. Now can you think of a remedy? You are thinking of veratrum because of religious? Craving of ice. What else? Okay, what miasm is predominant in this case? Psychosis and asthma. Both are psychotic. So what is predominant in this case? Psychosis, psychosis and psychosis. There's nothing else, right? So we have to think of a remedy which is predominantly antipsychotic, which would cover both asthma as well as gynecomastia. And what is the most important thing? It should cover the religion and the craving for ice. And what is the most important thing in this case? The father is very dominating. Father is very dominating. So what happens when the father is so dominating? There's a lot of suppression. So you have to think of a remedy which feels this as a shock. What is the remedy? See, what you said is right. All of you said the right thing. Veratrum, Lycopodium, Bryonia. But Medorinum is the remedy. And what is the characteristic of Medorinum? Medorinum is a wonderful person unless received a shock. Once he receives a shock, the whole system goes in a toss. And you can see the child was absolutely normal, enjoying his life. Father dominates. It gets suppressed. It has to express in the form of asthma and gynecomastia. An amazing result happened. Okay. So 3 remedies which came: veratrum, arsenic and medorinum. On working, you say hot remedy, you apply a filter of hot remedy, and the only remedy which was covered is medorinum. Now what potency you will give? 31 dose every night. Now why? Lot of suppression, beautiful, but lot of suppression, that means you require higher potency. Psychosis. One reason is psychosis. Second, expression at only physical and pathological level. No. Could you see at the mental level any expression? No, there were no expressions at the mental level. So there is no point in giving higher potency. Now, another thing which is very important, repetition in this case. What was the kind of progress of the disease? Slow, steady and gradually disease was progressing, the growth was increasing. And what would happen if we don't give the result? Patient would run away. So we need to give frequent repetition. You saw, see every point which I expressed here, I am showing you here in the practice. We said in psychotic, frequent repetition is required, low or medium potency and frequent repetition. It was given for a long time. Within 3 months the swelling subsided totally and he was able to face everybody. And he felt as if he never had asthma. So we started giving it for every day. We gave it for about say 3 weeks or 4 weeks. Then there was a gap which was given because it was regressing, and there were some occasions where he would express that now there is no improvement. We would give few doses. But only 30 potency and frequent repetition. No other medicine, nothing. So this is the kind of response which we can get with the right medicine. How in this case nosode was given frequently, and what was in the here the nosode became the constitutional medicine. The nosode became the constitutional medicine. There are a number of ways in which a nosode can be administered. It could be even acute. It could be even an acute prescription. It could be an opening prescription. It could be for clearing of the symptoms. It could be for the maze of the symptoms. It could be as an intercurrent remedy. It could be a constitutional remedy. Okay? It could be given when your indicated medicines don't work. So there are 10 to 12 different indications on which you can give antimiasmatic medicine. I'll give you a very beautiful case, very interesting case of a very severe cardiac asthma. I was in Belgaum in one of the medical college. I was just having a round in the ward. There was a patient who was having a very severe cardiac asthma. Very severe cardiac asthma, not responding to any treatment. I was just having a round, and what I saw, the patient was sleeping, or rather sitting in a knee chest position, like Muslim pray, namaz, with his head down and palms up. So he was sitting or sleeping in that particular position. I just was passing, I called the treating physician. I said, give him medorinum. He was with acute breathlessness, even the laxatives, nothing was helping this patient, and he could not even walk 2 steps. So when we saw this position, this is typical of medorinum, knee chest position. If you get a lot of children in that position, just close your eyes, prescribe medorinum, it will produce the result. It's one of the remedy which goes deep down to the genetic level. Which are the remedies which can go deep down to the genetic level? It is medorinum, baryta, calcarea flor, syphilinum, phosphorus and medorinum. These are the remedies which can go and change even the genetic pattern. And not one cases, I can give you series of cases based on the response. Even lot of cases where genetic deformities or defects rather can be corrected. We all make mistakes. This case I am sharing with you, how we make mistakes in our prescription. This was a very interesting case which came to me. A Muslim patient reported with asthma, with severe breathlessness. He was brought on stretcher. He could not even move. He was aggravated by cold things with marked perspiration, and he was better by warm things. Hot patient, better by warmth, aggravated by cold. What is the remedy? Arsenic. Which arsenic? Arsenic albumin is chili. It's chili. Ask iodide. Simple, not iodide sulf. Ask iodide. So even I thought of giving ars iodide. I said it's a very clear case of arsenicum iodatum. I was very happy. I said the patient is brought on the stretcher. I've got the remedy. I'll be able to help the patient. Very good. The patient was on many bronchodilators, many steroids and many drugs. What would you do? Do you stop those medicines? No. So what I did, I gave ars iodide 6 potency and frequent repetition. Okay? And there was no much time to take the history because he was feeling so breathlessness. The relatives were with him and too many people around him, and so I said, okay. I gave arsenic iodide 6 potency, worked out the case, and to my surprise, there was only partial relief. You can see chronic inflammatory state of the lung and bronchial tubes. The patient was given arsenic iodide every 2 hourly. Only